name is Sahil Mehta. I'm 26 years old. I have a degree in engineering from Rutgers University. I currently work as a freight broker, a dance instructor, and a DJ. I don't actually know what life is without type 1 diabetes because I was so young when I originally got it. 9 times out of 10, it's your blood sugar. It's either too high or too low, and our job and goal of keeping it within range the whole time. If our blood sugars aren't aligned properly, we can't function throughout the day normally. If our sugar is too high, we're out of it. If our sugar is too low, we're dizzy. It's been 21 years of me trying to figure out. There's no perfect formula. You're gonna move your body, starting from the armpit. 1, 2, 3. Switch. 1, 2, 3. Switch. 1, I'd say, 2, 3. Out of my own pocket, I'm probably, putting 20% of what I make in a year aside for just insulin.
As the cost of prescription drugs rises, Americans struggling to afford their medicine are looking for alternative ways to get cheaper drugs. And one of those ways is looking beyond our borders.
So this is an insulin vial. So this is kind of like our ride or die. We need this more than anything else.
And how long does that last you?
This could probably last me for about 3 weeks.
Since type 1 diabetics can't produce insulin, a hormone that helps process sugar, they need to inject artificial versions in order for their bodies to properly function.
This we bought for $36 Canadian. In the US, this is about $328 for one vial. So, a tenth of the price. Even I think with my copay, it's $40 or $50. So my copay after having insurance is more expensive than just getting this from Canada.
And then going to Canada though, to get supplies like your insulin there, how much do you think that would save you?
Maybe easy between $200, $500 I would say.
In the US, a vial of fast-acting insulin will cost more than $300 out of pocket. In Canada, that same vial costs $34, which is why Mehta traveled across the border with a group of type 1 diabetics to buy his prescription drugs.
In 2012, the US spent $250 billion on prescription drugs. By 2016, that number had reached $341 billion. Between January and June of this year, prescription drug prices jumped by 10.5%, rising 4 times as fast as the rate of inflation. For example, over the course of 5 years, the amount one person spent on insulin nearly doubled, which is why candidates are bringing this up on the campaign trail.
If I am elected president, I'm going to cut prescription drug costs in this country by 50%.
We have got a Medicare system that is still to this day unable to negotiate down drug prices with prescription drug companies.
What I'm prepared to do is, one, to require that the pharmaceutical companies pay a fair price for drugs.
Public opinion polls, including ours, consistently show healthcare is one of the top issues facing America. And both Democrats and Republicans are concerned with lowering the cost of care, including the cost of prescription drugs. The top Democratic candidates for 2020 have a lot of different ideas to bring down these costs. Allowing the government to directly negotiate drug prices for Medicare, setting price limits on drugs based on their cost in other countries, increasing access to generic versions of brand-name drugs, and importing drugs from Canada and Mexico. And at least on this one issue, the Democratic candidates' proposals actually aren't that far off from Republican President Donald Trump's proposals. Trump has said he wants to cap U.S. drug prices based on their prices in other developed countries. He's proposed new pathways for states, pharmacies, and pharmaceutical companies to safely import drugs from Canada. And he's working to increase the number of approved generics on the market. In his action plan to lower drug prices, Trump mandated drug makers disclose list prices in TV ads and suggested eliminating the use of rebates and discount programs that make prescription prices less transparent.
We will have tougher negotiation, more competition, and much lower prices at the pharmacy counter. We have middleman problems. We have a lot of other problems. Well, we're ending many of those problems today. I think we're going to have some of the big drug companies in in 2 weeks, and they're going to announce, because of what we did, they're going to announce voluntary, massive drops in prices.
But so far in Trump's first term, most of those ideas haven't panned out.
Whenever you're trying to do anything in the healthcare system, there are swampian special interests everywhere.
Katie Talento served as one of President Trump's lead healthcare policy advisors from early 2017 until June of 2019.
President Trump has suggested a lot of other ways to try to bring down drug prices as well. Why haven't those solutions really worked so far?
Congress needs to act, and they haven't acted. They haven't done much on healthcare at all. And I think it's time. I think American people really want a bipartisan solution. The president has put out one proposal after another. In some cases, special interests have sued him in courts and tried to get things stopped.
So you feel like there is room here for a bigger, bipartisan, comprehensive solution?
Absolutely, and I think the voters are demanding it. I think this issue has actually become less and less partisan over time. And the president knows that if he wants to make America great again, he has to make healthcare great again.
For those of us who are Americans, we love our Canadian neighbors, and we thank them so much. But we should not have to come to Canada to get the medicine we need for our kids to stay alive. Our job now is to end the incredible corruption and greed that exists in the pharmaceutical industry.
Do you feel like you couldn't continue to be able to afford insulin in the U.S. if you weren't working 3 jobs?
I mean, between having 3 jobs and having constant family support, insulin is not necessarily affordable, but we're able to get it. And I can't control whether or not I can get my insulin unless I kind of stretch myself so thin.
About 8% of people in the U.S. say they've purchased prescription drugs in other countries in order to get a lower price. But that isn't an option for everyone. While diabetics like Meta are hopeful for a cure, they're looking to politicians in the meantime to bring them more affordable care.
I've donated so much money personally to diabetic research, but that's not helping me at the end of the day. It'd be great to know that our pockets aren't going to be depleted while we still continue to wait for a cure.